Okay, we're here. We're ready. All right, let's alphabetically, but with people who are doing, I guess, catch up as far as just the topics. We couldn't fit them all on their day. We're going to start with Bailey, and then we'll do Neva, and then we'll move into the actual genitourinary stuff with Star. Bailey. Here we go. Okay. Yeah, okay. Left and right arrows are probably best, or you can scroll.
Okay. Yeah. So, as you know, there are several viruses in this world. They fall under several different categories of biosafety levels. There are only 4 classifications of biosafety levels that exist. Category 4 contains the most dangerous and fatal pathogens without any vaccines and treatment available. This level consists of hemorrhagic viruses. You may think of Ebola, which falls under the group. But what if I told you that there is a hemorrhagic virus that's just as deadly as Ebola? So today I will be talking about the Marburg virus, an exotic and highly virulent microbe. So where did it come from? Marburg virus disease, or MVD, is a rare hemorrhagic fever virus that first appeared in 1967 in Marburg and Frankfurt, Germany, and Belgrade, Serbia. This virus caused 2 large outbreaks, which were associated with laboratory work on African green monkeys, which you can see in that image below. The prime carrier for this virus is the cave-dwelling Egyptian rosette bat, which can be found widely across Africa. And as you can see, I also put an image of the bats. Because of their wide geographical range, many areas are at risk for outbreaks of MVD. Primates and humans are most susceptible to this virus with high mortality. So, virulence factors. The Marburg virus disease is highly virulent with a fatality rate of up to 88% or higher, and has the potential to cause epidemics throughout Africa. It is a filamentous virus with an envelope and is single-stranded. Since it is classified as risk group 4, it requires extreme barrier protection measures. Sorry, flip page. For laboratory personnel and those that are caring for infected patients and deceased bodies. So how is it transmitted? Fortunately, this virus is not airborne and cannot be transmitted this way. It is also not contagious until the infected individual is showing symptoms. It requires extremely close contact in order to be infected and occurs through person to person. This virus spreads through blood and other bodily fluids, contaminated objects like clothes, bedding, or medical supplies. Water droplets in the air from close contact coughing, and can even persist in the eyes and semen after recovery. So here are the risk factors. The risk of exposure for MVD includes coming into contact with someone who is infected with this disease or a primate that is infected. The highest risk includes family members or hospital staff that have cared for individuals infected with the disease that have not been disinfected properly. People are also at risk if they come into contact with the main carrier of MVD, the Egyptian rosette bat, if entering a cave or mine inhabited by the bats. So these are the signs and symptoms. Marburg can have an incubation period of 2 to 21 days. Early signs and symptoms are similar to influenza, and after the sickness progresses, it is similar to Ebola. These symptoms include muscle aches, fever, chills, headache, and sore throat. 3 days after the illness, bloody diarrhea, abdominal pain, nausea, and vomiting will begin. After 5 to 7 days, individuals will develop severe hemorrhagic signs, including bleeding from the eyes, mouth, nose, ears, and rectum. The individual may also develop a rash all over their body. After 8 to 9 days, symptoms will get much more severe. This can involve unbearable chest pain, extreme weight loss, seizures, shock, and multiple organ failure, and of course, death. So diagnostic methods. Since Marburg symptoms are similar to other hemorrhagic fevers, laboratory diagnostic tests such as ELISA, serum neutralization test, PT-PCR assay, virus isolation by cell culture, and electron microscopy are required for an accurate detection by healthcare professionals. So there are no treatments and vaccines for Marburg. The best solution is supportive hospital care, including rehydration with intravenous and oral fluids. Marburg is usually fatal, but people have survived. However, the Marburg virus is another reminder of the many zoonotic pathogens that are very capable of causing severe harm to human health and, most importantly, death. That's it.
That bat is cute though. My dog Meatball looks like a prettier version of that bat. He looks like a bat to me. So, alrighty, it's gonna be Nina. All right, you should be able to click or scroll or use the arrows for this.
These will work. Okay, so I did mine on feline panleukopenia. Panleukopenia is a highly contagious virus that can infect all felidae species. So this is going to include the domestic cat and then large wild cats as well. The word panleukopenia stands for a diminished amount of all white blood cells present to help fight infection in the body, which we have learned white blood cells are very important. So the etiological agent, feline panleukopenia, is a parvovirus and is in the family Parvoviridae. These are known to be some of the smallest viruses with a diameter of 18 to 26 nanometers. And the virus can last in the environment for a very long time. Panleukopenia is a naked virus, meaning that it is non-enveloped. This makes it very hard to kill. It is able to survive simple disinfectants and heat, so they have to use like bleach mixed to a correct dilution or the disinfectant called Rescue to kill Panleuk. Panleuk virus enters the cell using endocytosis, but more specifically clathrin-mediated endocytosis. Mode of transmission, oral ingestion of infected bodily fluids. This is primarily going to be fecal oral, but it could also be through vomit, direct contact, indirect contact, such as a fomite. The incubation period is 3 to 5 days, so they present with symptoms pretty soon after exposure. And then treated patients can spread the virus for up to 6 weeks. So a lot of people have probably heard feline panleuk called kitty parvovirus. Panleuk and canine parvovirus are in the same family, Parvoviridae. They are species specific, so you cannot, your cat can't get Panleuk from a dog that has parvo. But due to the similarities, we can use the canine parvovirus test to diagnose Panleuk. So risk factors are going to be unvaccinated cats, young cats, improperly vaccinated cats. So they didn't receive a correct booster. They just got the initial vaccination. Cats in close quarters, such as a shelter environment, and then stressed cats because they're going to be their immune system is going to be compromised. So signs and symptoms are going to be diarrhea, anorexia, which just means not having an appetite, not wanting to eat, fever, dehydration, vomiting, lethargy, and abdominal pain. Typically with Panleuk, the 2 first signs that you see are anorexia and vomiting. Diagnostic methods. So there's no specific test for Pan-Luc. Your veterinarian can diagnose it on clinical signs, so the signs and symptoms that were mentioned. PCR test is not going to be quite as common. Snap ELISA canine parvo test. So as mentioned, the parvo and Pan-Luc are in the same family, and they share a lot of similarities. So we can use this fecal viral antigen test to diagnose Pan-Luc. There are arguments whether this is, how accurate it is, but they do pop positive if they are positive for Pan-Luc sometimes. And then they can use blood tests such as looking for neutropenia or lymphopenia. Differential diagnoses are going to be Campylobacter. They're going to present with diarrhea, vomiting, anorexia, not wanting to eat. Coccidia, this is going to be more commonly seen in shelter and rescue environments. So probably one of the more common ones that it's confused with. That's going to be dehydration, diarrhea, abdominal pain. And then feline leukemia virus and feline immunodeficiency virus can also be differential diagnoses. So the mortality rate of Pan-Luc, kittens under 2 months of age have a 95% mortality rate even if treated. Kittens 2 months and older, 60 to 70% mortality rate with treatment and 100% mortality rate if untreated. So shows how deadly it is. Patient treatment and care. There's no specific treatment for it. It's primarily just going to be supportive care, such as fluids, nutritional support, pain and nausea management. Most cats that are diagnosed with Pan-Luc are going to be put on a strong antibiotic to help manage secondary infections. And then plasma administration is starting to kind of emerge a little bit more. It's not a widely recognized form of treatment, but some patients have shown positive outcomes when given plasma from an immune cat. This is primarily going to be used by shelters and rescues. Your veterinarian may use it, but it's kind of, like I said, not real widely recognized yet. So I thought it was appropriate to talk about shelter cats and Pan-Luc because we see Pan-Luc a lot in the shelters. Since we have a lot of cats with unknown health backgrounds, if they're unvaccinated and they're in close quarters and stressed, this highly contagious virus can spread rapidly in a shelter environment. So shelters are going to have very strict vaccination protocols. Animals are going to be vaccinated upon intake, and then all those boosters are going to be kept current while the animal is in their care. They also have strict disinfectant handling protocols. They're going to be regularly disinfecting kennels, litter boxes, food dishes, and then wearing gloves and gowns to handle cats and changing those in between to help to control the contamination. So we do have a vaccination for panleukopenia. It is in the FVRCP vaccination, which stands for feline viral rhinotracheitis calicivirus and panleukopenia. Kittens should receive this vaccination every 3 to 4 weeks until they are 16 weeks of age. It is important that they receive it until they are 16 weeks of age and just don't get like 3 vaccinations. And then adults should receive a booster yearly. And then it also just maintain good biosecurity. If you have are bringing an unvaccinated cat or a cat without like a background, known health background into your home, make sure you're keeping them quarantined. And then as always, follow your veterinarian's vaccination recommendations. And then these are my sources.
Just to do this properly the right way. Yeah, okay. So the arrows are probably your best bet on that one, left or right.
I'm doing mines over urinary tract infections, which is also known as UTIs. It's a common type of bacterial infection that can affect any part of the urinary system. That includes kidneys, bladder, the urethra, and ureters. There are several different types of UTIs based on the location within the urinary system. The most common type is the lower UTI, which is also known as the cystitis, which affects the bladder and causes symptoms like frequent urination and a burning sensation. The upper UTIs, such as the pyelonephritis, includes kidneys, which are typically more serious, causing symptoms like back pain, fever, and nausea. The most common bacteria associated with UTIs is the E. coli. Risk factors for UTIs include being a female and having a shorter urethra, being sexually active, using certain types of birth control, experiencing hormonal changes, having a weakened immune system, having a history of UTIs, and not drinking enough water. People with,
Sorry, I'm getting
it's okay. People with conditions like diabetes, kidney stones, and enlarged prostates are also have an increased risk of developing UTIs. Certain lifestyles, like holding your urine for long periods of time, wearing tight clothes, symptoms of UTI can include a frequent need to urinate, a burning sensation, cloudy or a strong smell of urine, a pelvic pain, fevers, chills, as well as blood in your urine. You should also get a urinalysis taken. And then treatments for UTIs typically involve a course of antibiotics to eliminate the bacteria causing the infection. The type of antibiotics depends on the type of severity of the UTI, as well as the underlying health conditions that the patient have. Drinking plenty of water can flush out bacteria from your urinary tract. Over-the-counter pain relievers may also be a good recommendation to alleviate discomfort. Azo is amazing. It is important to complete the course of antibiotics prescribed by your PCP to ensure that your infection is fully treated. If the UTI is recurring or severe, further observation may be needed to determine the appropriate treatment plan. Preventative, proper hygiene, stay hydrated, and urine before and after sexual activities are recommended to prevent UTIs. Taking showers instead of baths, minimizing douching and sprays in the genital area, and teach little girls when potty training to wipe from front to back, and then drink lots of cranberry juice. If left untreated, UTIs can lead to more serious complications such as kidney infections. And this is it.
It's just that time of year where I'm like, I feel like the semester's over, but the work doesn't feel that way. So, okay. Where is it? All right, just to review what we learned about last time. This is the last time that we're going to be reviewing this too. So, and it's the last chapter, so it's nice to know that we're seeing that light at the end of the tunnel. What is the most common infectious disease of human beings? That one, dental caries. So that's going to be basically tooth decay. What is dysentery? Bloody diarrhea. What pathogen causes rice water stool? That is Vibrio cholera. What types of hepatitis have vaccines available? It's just A and B for now. And what type of pathogens are Opisthochus sinensis and Clonorchus sinensis? They are helminths. More specifically, they are flukes. So there's their nice fancy little words for them. Platyhelminthes and the trematodes. You know, my husband is business out of town on business, and you would think that it was the end of the world for that man. Can't handle being away for a night. He's only in Tulsa. He's not far. So we've got for a review of our urinary system for those of you who haven't taken anatomy or aren't as familiar with this. We have the kidneys that are going to be filtering waste out of the bloodstream. The waste collects in the bladder via the ureters and will exit the body via the urethra. The function of these can have, some of this can have protective aspects, such as the flushing of the urine and the desquamation of the cells in the urinary tract. What I'm saying by that is just shedding the cells. Bacteria that are adapted for the GI system typically aren't going to be adapted for the urinary tract either. The acidic pH of the urine, the lysozyme, the lactoferrin, and the secretory IgA are also defenses. Remember, lysozyme breaks down peptidoglycan walls, and lactoferrin hoards away iron so the bacteria can't get it when they need it. All right, next is the male reproductive system. The structures that we're mostly going to be primarily concerned with here for our STIs is going to be the penis. We are going to be talking about the difference between a circumcised versus uncircumcised risks as far as getting disease. So that's important to understand that that's discussing the foreskin and whether it has been removed or not, the testicles, and the prostate gland itself. For females, a lot of these STIs are going to be affecting the female anatomy a little bit more intricately, if you will. So that we have sometimes effects within the vagina, leading from the vagina into the uterus via the cervix, of course. And then outside of that, the uterus, of course, where our eggs are going to be moved from our ovary into the uterus via the fallopian tubes on each side. So those structures, as well as the external structures of the labia, can all be involved in these STI presentations. For females, our reproductive tract can have defenses that can include the pH, mucus production, and things related to that, as well as, of course, the biome of the area. But all of this is going to vary quite widely over the lifetime of a woman, depending entirely on hormonal levels. So this could be when you're a child versus when you are an adolescent and actually getting like your first period and going through puberty. During puberty, after puberty, in your childbearing years, perimenopause, and then menopause. But even past that, anytime that you're going through your menstruation can alter the biome. So that can all affect the overall state of the female reproductive tract, especially with considering things like the mucus secretions, the pH, and things like that. When you're in your childbearing years as a woman, you also tend to have biota that protects any potential fetus that you could be carrying. It's pretty interesting to think about. But some things to consider: the female urethra being short makes you more susceptible. It really does, truly, to UTI. So that's why females tend to have more UTIs than men do. The bacteria, like we already discussed, typically E. coli, is going to be associated from your own, GI biome, coming from your own anus, basically. So we did discuss about hygiene relating mostly to that. Then we have male presentation of foreskin or lack of foreskin due to circumcision. Now, it turns out that the biomes for the male genitalia differ based on whether or not you are circumcised or not. The bacteria from the moistness associated with having foreskin and the folded skin, the bacteria associated with that tend to be a little bit more inflammatory in those areas. Not necessarily massively or uncomfortably so, but just enough that it can make you more susceptible to infections in general. And that's the truth. It doesn't have anything to do with cleanliness. The guy could be perfectly hygienic in all ways, and all of that. And of course, that would affect if it wasn't. But even just not being circumcised can have you a more inflammatory biome, making you more susceptible to being sick from a lot of these diseases. So, anyways. Both males and females have high counts of lactobacillus as part of their biome naturally. That's a very important thing in maintaining the pH of both. Men also tend to have streptococcus species. There's shifts when sexual activity begins due to exposure to other individuals' biomes, of course. Exposure to one person's biome can be carried to the next person to cause vaginosis and things like that, basically unstable biome in the new partner after being exposed. So that can not necessarily be a sexually transmitted disease, but can be caused from sexual contact, if that makes sense. So For women, we kind of already talked about that lactobacillus being important for pH. We also have presence of Candida albicans as being normal in the female reproductive tract. So it should be there, but just not in excessive amounts. We already talked about urinary tract infections, so I'm not going to get into this too much. So we're just going to move on. Leptospirosis is a zoonotic disease. So this is, in fact, something that we're more concerned about typically in animals and our pets. We do have vaccinations for lepto, especially for dogs. And at least I don't know that much about the cats. Do cats get vaccinations for lepto? Do you guys know? Nobody know? No? I know that the dogs can. So that's what I know. My dog.
Cats can't get lepto.
There. So.
Goodbye now.
Okay, thank you. So we
Welcome.
have we have with leptospirosis, as far as whenever it does cross over into people, we have the leptospirosis. That was just hilarious. I thought it seemed like a voice out of heaven or something like that. Leptospirosis phase versus the immune phase. Leptospirosis phase is like, yeah, if you're as a human anyways, you can see that the pathogen's in the cerebral spinal fluid, but you're having symptoms more of just being sick. Whereas the immune phase in humans, that's going to be a mild fever, headache, and even developing into meningitis. So now, even though it starts out mild, it can develop into much more severe disease, and it tends to be a little bit more of a chronic display of symptoms. Weil's syndrome can develop. This is going to involve kidney invasion, hepatic disease, that's the liver, jaundice, anemia, and neurological disturbances as a result, and can lead to death if it is not properly treated. This is caused by Leptospira interrogans. This is a spirochete. This is bacterium. And here we have adhesins and other proteins that help it penetrate host cells so it can get into the cells themselves. It is shed in the urine. So urine spread into water, spread into the soil. That's how this is spread from animal to animal. So it's actually pretty easy to spread. They treat this with penicillin and doxycycline are treatments of choice, but they will treat with ceftriaxone in some severe cases. Moving on to schistosomiasis, which we mentioned this last time in the GI stuff. But in urinary cases, this is usually caused by schistosoma hematobium and not Mansoni or japonicum, which were the other ones that we were talking about as the blood flukes. So this guy gets into the urinary tract. You'll have the same itchiness in the skin where it gets in, usually from swimming, right? Imagine if somebody next to you had this and urinated in the water that you were bathing in, and then that's how this gets spread from person to person. And to feel quite ill, but this can even lead to a chronic infection that can cause severe inflammation of the bladder and other organs as well. But basically, you're going to treat this with praziquantel. And this guy, remember, all schistosomes are going to cloak themselves in proteins that I don't know, that to hide from your immune system. But I say proteins, your own proteins, like from your own bloodstream. Okay. So true vaginitis. True vaginitis is only going to be caused by two things. I want to be clear about this. I'm going to make a note of it on the board, and unfortunately this is, oh no, this won't work actually today. Let's see if this works today. Oh, it does. Okay. Cool. So, vaginitis and vaginosis. This is just infection of the vagina. This one is inflammation. Pretty much when we're talking about vaginitis, inflammation, true inflammation of the vagina, not talking about the tissue outside of it, not talking about any other organs, just the vagina. This is it. Okay. None of the other diseases that we're going to talk about actually cause vaginitis. They can cause pelvic inflammatory disease. They can cause inflammation of your fallopian tubes and all sorts of stuff, but not the vagina. Okay. So just making it clear, because if I ask which organisms cause vaginitis, and you're like, well, we talked about all these things. No, we talked about Candida albicans, which is a yeast infection, and we talked about Trichomonas vaginalis, which is protozoan. Okay, so starting with Candida albicans. yeast infection, normal yeast infection. It's actually present in somewhere between 50 to 100 people, percent, not number wise. 50 to 100% of people can carry this naturally. So it's hard to get the numbers because you just don't really check for it. Whenever you do get a yeast infection, you can see white curds developing on the inside walls of the vagina. If you were to examine the inside of the vagina, it can become quite uncomfortable, painful, even itching. But that is what we would see with the yeast infection. We treat these with the azole drugs. So miconazole is usually the one that would be used over the counter. It's going to be monostat, that sort of stuff. So, all right, then we have Trichomonas vaginalis. This is sexually transmitted disease. It is protozoan. Men usually don't have any symptoms. In females, you can have a white to green frothy discharge associated with this infection. It can cause low birth weight infants as well as premature birth. And it is the most common non-viral sexually transmitted infection. There you go, for what it's worth. I worked in Southwest Integris, y'all. We got a lot of hookers. We had a lot of hookers coming in for testing. I worked in the lab, and so we got all those samples sent up to us, and so I got to see quite a lot of these thin preps and these washes and stuff like that sent up to us to see if these hookers had whatever STIs. And trichomonas was an interesting one because you can see them quite clearly swimming around in the microscope. In a way, that's kind of interesting, right? So for what that's worth, but they treat this with metronidazole. That's vaginitis. Now, this is vaginosis, or if you guys have heard of it, bacterial vaginosis, or BV, right? So a lot of us ladies have heard about this. This is usually overgrowth of bacteria that are normal in your vaginal canal. Nothing out of the norm as far as what types of bacteria it should be, but it's the ratio that's off. So usually we have too few lactobacilli present for whatever reason, exposure to a new partner, anything that could throw off your normal biome. That can lead to development of BV. It can also be due to introduction of new bacteria from somebody else's biome that can throw off your own. Either way, you'll notice here we'd be like, okay, well, this is an inflammation of the vagina. That must not be that severe, but BV can lead to pelvic inflammatory disease, infertility that can be permanent, and ectopic pregnancies. For those of you who don't know the way that ectopic pregnancies can form, it has to deal with the egg not being able to travel through the fallopian tube. In this case, we're talking about inflammation of the fallopian tubes to the point that the egg can't make it out. And so even though the sperm can get in, because it's much smaller, the egg can't get out. And so you see development of the embryo within the fallopian tube, which can cause the fallopian tube to burst, causing severe injury and all sorts of problems with that. So you don't want to have any ectopic pregnancies if you can help them. So this is not sexually transmitted, but it is related to sexual activity sometimes. All right, prostatitis. This is inflammation of the prostate gland. You can have acute or chronic versions. The main difference anyway, is the chronic version, we see a development of biofilms in the prostate. So the bacteria that are getting into the prostate have now developed into biofilms. And that is much more difficult to treat. This is usually associated with the bacteria from the GI tract. Now, this isn't necessarily from your own GI tract, just saying, but we do see this associated with unprotected anal sex, typically. But yeah, so acute, we will see just the bacterial causing an infection that can lead to inflammation of the prostate. Chronic will be development then of that bacteria into those biofilms. Very, very painful. Pain in the groin, pain in the lower back, frequent urge to urinate, but very difficult, very, very extreme even, difficulty urinating, blood in the urine, and painful ejaculation. Someone brought up in one of my other classes the other day, they asked me, is this like what happens in the Green Mile? And I said, yes, it's exactly what they're portraying in the Green Mile. If you guys haven't seen it with Tom Hanks, it's a fantastic movie. But yeah, he gets prostatitis, and then the guy in the movie who has this sort of gift, if you will, heals Tom Hanks. But yeah. Anyways, gonorrhea. So males with gonorrhea usually going to have be asymptomatic. most of the time, not always. When they do have symptoms, they will have painful urination due to urethritis. They'll have yellowish discharge from the penis as well. Females, though, they will have symptoms, mucopurulent or bloody vaginal discharge. When I say mucopurulent, I'm talking about a mucousy discharge that is pus-like, okay? Basically a lot like pus, or mixed with pus, even literally. So this is also going to lead to painful urination from inflammation in the area. This can cause salpingitis. That's going to be inflammation of the fallopian tube. That's the term for that. Or PID. And that can be quite serious. And we talked already about ectopic pregnancies and stuff as a result of these types of inflammation. But children who are born to mothers that have gonorrhea can become blind due to exposure to the bacteria in the birth canal. So here's some images talking about that. But yeah, we have scar tissue developing from the inflammation and everything like that. And then we have the ectopic or tubal pregnancies that can occur, as well as infections associated with the bacteria itself. All right, this is caused by Neisseria gonorrhoeae. This is also known as the gonococcus. It is the same presentation-wise. If you were to look at it in a microscope, the butts, like I had said, with Neisseria meningitis, they look like two of them stuck together. You can see some of them in here are looking quite clearly like that, like this one here. But yeah, they're two cocci that'll be stuck together. They look like little butts, but it's very, very characteristic presentation of Neisseria species in general. So we do see that Diplococcus. They use fimbriae to attach. They have phase variation to change their surface to hide from your immune system. It's transmitted through any kind of sexual contact. It doesn't just have to be genital related. Genital to genital is what I'm trying to say, genital penetration. We have the inflammation associated with gonorrhea is going to make you more susceptible to HIV. So if you let's say that anytime that you were to have, sexual contact with somebody, you're 50% chance of getting HIV if they're HIV positive. Well, this is going to increase that significantly due to the inflammation in your body, making you more likely to get the virus in. So there are several isolates out there now that are completely antibiotic resistant. There are no antibiotics available anymore. So it's quite concerning. Next, we have chlamydia. This is the most common reportable infectious disease in the United States. So it says the most common reportable infectious disease, but of course here we're talking about sexually transmitted infections, and that's nice, but maybe you're thinking like, oh, okay, the most common reportable infectious disease, isn't that cute? But there are so many others that are more common than this that are not reportable. So I want to make that clear. Like we already said, one of them, which was Trichomonas vaginalis, right? That's not reportable. The CDC doesn't care because it's so common that CDC doesn't care and doesn't track it. But chlamydia, they do track. So that's just how I'm putting that into perspective. This is one of those cases where the females will be less likely to have symptoms. 75% of females don't have any symptoms for this, but if they do, cervicitis, discharge, salpingitis, and PID, like we've been seeing with a lot of these other guys. Males will have discharge and painful urination, so they will present with symptoms this time. This can develop into something called lymphogranuloma venereum, where we have infection of the nearby lymphatic tissues, leading to just feeling really sick, and be affected by it that way instead of the typical presentation. But this is a bacterium called Chlamydia trachomatis. We already talked about trachoma causing blindness in some cases due to the scarring from the inflammation in the eyelid, leading to blindness as a result, and it's the most common cause of infectious form of blindness. So, but yeah, here we're talking about the genital version. Usually you see this along with gonorrhea. All right, next is syphilis. Super old disease, been around for a very, very long time, basically as long as sex has been around. And it's well known for the dementia that it can cause, as well as the disfigurement that it is associated with. In the 30s, there was something called the Tuskegee study of untreated syphilis in the Negro male. This was some Black men that didn't know how to read, didn't know how to write, and were approached by scientists. I mean, let's be honest, probably all of them white. And they were saying that we can treat your syphilis that you've contracted, no problem. Just sign up for our study unless observe, your recovery. But they didn't treat them at all. They just watched to see basically these men die from this disease. They could record what happens to people whenever they are left untreated from syphilis. But because these men couldn't read or anything, they didn't know what papers they were signing. And so they were, tale as old as time, unfortunately. So it's definitely something that we should all be aware of. There is a book about this, if you are interested in reading about that, but certainly something that we should not forget about our history. All right, moving on to our signs and symptoms of syphilis. We have 3 stages of syphilis. Primary syphilis. There is this, I always want to call it a canker, but apparently that is incorrect. That's not how you pronounce this. You usually are supposed to say this chancer, I believe, but I'm not going to say it right probably. So whatever, you see the word, that word that I keep wanting to call canker apparently is not pronounced that way. It's a small red hard bump that is going to appear at the site of entry of the bacterium when you're exposed. So if you have had, genital penetration, then it's probably going to be on the genitals. If you've had oral sex, maybe on the mouth, etc. You get the idea. So this will appear on the external and the internal genitalia, depending on where the actual bacterium literally gets into the body. But it is small and it tends to be relatively painless. That's just the first stage of syphilis. In secondary syphilis, we have presentation with fever, headache, sore throat, and swollen lymph nodes. Cool, so you're sick. Sometimes there's hair loss associated with development of this, but the big characteristic of the secondary syphilis is going to be the rash. And it is it looks like a stain with a brownish red spots, more than it doesn't look like petechiae, and it doesn't look like spots or bumps like chickenpox or even like the measles. But this is quite characteristic of syphilis, and it's very common to see it on the palms and the soles of the feet, and it can be all over the body potentially. Tertiary syphilis, you can be latent, and it can just live with you for a while, causing minimal presentation. But if you develop into tertiary syphilis, we have damage to the vascular structure, basically, as well as development of these things called gummas. And they are basically just tumors, but not true tumors. They're structures that look quite a lot like tumors, and they're very disfiguring. You also have essentially the presentation of that bacteria now eating away and causing craters in the skin and disfigurement that way. Then neurosyphilis presentation, headaches, convulsions leading to blindness and dementia. And in the middle there, we have Argyll-Robertson pupil, which is where you shine a light in someone's eyes and it does not constrict. They'll just stay dilated. You can see cases of congenital syphilis. These are babies that are born to mothers who have syphilis and can lead to miscarriage and stillbirth, but also certain kinds of fetal abnormalities. It disrupts certain periods of growth. So here are some images. You guys are so lucky. I was telling my other class about this. My old talk before we got the new textbook, because you guys actually have a new textbook. But the old one had so many pictures of all of this stuff that it was just like pictures, basically, mostly, and not as much talking. So here we go, though. We have that chancer in image A. In image B on the bottom, we have that foot that has that very characteristic rash that I'm talking about. It looks like your skin is like stained with it. And then in C, we have the bacteria eating away into the actual tissue structure of the face. We can even have enlargement of cartilaginous structures, like the nose can become bulbous but then also be eaten away at the same time. It's very common to see that sort of disfigurement with syphilis as it progresses. And this is a little baby that was born with congenital syphilis and just having some developmental problems as a result of that. This is caused by a bacterium called Treponema pallidum. It is a coiled spirochete. Again, it looks like phone cord, old school phone cord. But yeah, maybe people don't know what I'm talking about when I say that. I don't know. So yeah, it does have a very strong inflammatory response. It does have endotoxin. Of course, it's gram-negative, so it has endotoxin. We'll get inflammation from that. But other proteins on its surface also cause an inflammatory response, which is why we see the effects of the inflammation associated with this infection in its locations. Risk of infection, if you are having sexual contact with somebody who has syphilis, it's a 12 to 30% chance of contracting syphilis. It's pretty interesting, but if you don't want to risk it at all, probably recommended, right? Barrier protection is recommended. Okay. And it's treated with penicillin quite effectively. It's actually one of the first diseases to be treated with penicillin when it was discovered. So, all right, cancroid. This is one of those diseases where I'm going to tell you, be glad that I did not put pictures. If you are interested in looking up the effects of these or trying to, scare adolescent children or something like that, Google it because it is almost worth looking at some of these. But cancroid, this is caused by a bacterium called Haemophilus ducreyi. It is going to form a cancer. That's what I said, right? Cancer, whatever. I keep want to say canker. Let's just say it. Canker. It forms a canker that is soft. Now, this one's much larger than the one we see in syphilis, the little ones that we see with syphilis. This is much larger sore. It is softer and it is kind of oozy and weepy and stuff like that. So it can be quite painful, especially in men. And it says often unnoticed in women, but the pictures that I have seen, I don't know how. That's all I'm going to say. I don't know how you didn't notice it. We see this more commonly in the tropics and the subtropics, and it is associated with sex workers and poor hygiene, as well as being uncircumcised. And we treat this with azithromycin and ceftriaxone as needed. All right, next we have herpes. Herpes is forever, and I say it often, and I do mean that just because any herpes virus will hide out in your DNA. And once a virus hides in your DNA, there's really nothing we can do right now in medicine until CRISPR becomes more sophisticated and we can use it more effectively. But anyways, HSV1 and HSV2 are the two types that we have with this. We already got introduced by Brooke into HSV2. So I'm not going to go into too much detail with these, but I will say that it doesn't matter if it's HSV1 or HSV2, it's herpes, and you're not protected from one if you have the other, right? Just be aware of that. And also barrier protection, wearing a condom, something like that can help protect if the vesicles are associated with that area. However, if somebody has an outbreak on like their inner thigh, wearing a condom isn't really going to protect you from that. And it's the fluids from the vesicles that are associated with herpes that are going to be spreading the disease. Lastly, valacyclovir or acyclovir derivatives are used to keep breakouts under control. For the most part, that can prevent spread, but it's not 100% effective at preventing the spread, but it can prevent the outbreaks to the point that you live a more comfortable, more normal life. Neonatal was what the big issue was, that, right? With that being spread to the baby, which we already mentioned this before. All right. Having herpes, this is the other thing that I do want to bring up, because we're going to be talking about here in just a moment, HPV. That having herpes can be seen in a pap smear in some cases, if it's affecting that area that is being tested, because it can affect the cells there, but because it affects your DNA and can affect the cells themselves, it can make you more likely to present with cervical cancer. So it is something that they can kind of work together to give you a higher chance of presenting with the cervical cancer if you already have these things. But here are some of these images of the things that we were just talking about, with syphilis on the far left, cancroid in the middle, and then some vesicle formation from herpes. Looking at the differences there. Next, we have human papillomaviruses. So we can talk about it in two different ways. We can talk about cervical cancer, or we can talk about warts, right? We talked about warts already on like skin and other parts of our body, but you can also get this related to, sexually transmitted genital warts. With females, we see growths on the vulva and as well as in the vagina. You can also have the silent infection of the cervix, which is often what we would see with presentation with the cervical cancer. The cervical cancer strains are usually not associated with the warts. There's a lot of strains of HPV out there. Males, when they do present with warts in those strains, they'll have warts on their penis and the scrotum. Both sexes can have them on the anus, in the groin, between the thighs, in the pelvic area in general, and can even develop into condyloma acuminata, which is branching cauliflower-like masses of warts. So moving on to the cervical cancer aspect of HPV, the strains that cause cervical cancer. And whatever. So 4,000 women die each year just in the United States from cervical cancer. So we still have women dying from cancer. What is the best way to avoid cervical cancer? Well, I mean, obviously abstaining. If we could do that, we'd be perfect about that. But realistically, next is the pap smear. Keep up with your pap smears. It has completely changed the face of the United States as far as how many people we see being diagnosed and then dying from cervical cancer. In fact, most of the time when you do see women with cervical cancer and who die from cervical cancer, it's because they didn't get their pap smears. Haven't been getting it, maybe think about going. Especially when I tell you that the numbers tell us that over 90% of people who are sexually active at some point in their life will have contracted HPV of some kind. And maybe you may think that you didn't, or you may think that you didn't, but most of the time people don't have any symptoms. So don't just assume because you don't have warts that you didn't get HPV, because believe me, most of the time it's not associated with warts. You may not even know that you carry it. This is one of those times where it's like, you know, the come to Jesus moment, and actually having HPV being incredibly common. Most of the time you don't know that you have it though. That's the thing. So how do you track something like that? Well, you don't, unless you are going to your doctor to get your pap smears and you get positive, right? Very common. You go get your pap smear done. Your doctor calls you and says, we have positive for HPV in your pap smear, or they say we have some abnormal cells in your pap smear. Both of those things happened to me. I was that unlucky person. Actually, very common. It is. Unfortunately, you know, I was lucky enough though that I go back to the doctor and they can actually have the stuff they like rub on your cervix of all things. It's sort of weird. It's like a dye or whatever. It helps them see abnormal areas on your cervix so they know where to take samples from to check it. And it's called a colposcopy. And what they do is they pinch off pieces of your cervix to send for biopsy to go look for any abnormal cancer or anything like that. It's incredibly uncomfortable. I'm gonna tell you that right now. But they can actually remove all of the abnormal cells that are present at that time through the colposcopy. And even if they don't, and they'll check you in like 3 months, you'll go back for another one. And you'll keep up with it until, you know, they don't think you're a risk anymore. And that takes years of going back, a lot more commonly than most people would, until they no longer see presentation of the HPV and your body has cleared the infection, which is usually what happens. Your body usually will clear it all on its own. I was lucky enough that I cleared it on my own. I had the colposcopies done and everything came back normal after that. And able to clear it on my own. It's been years since I've had any issues with that. But I'm just saying this because it's my experience of it. And the only reason that I really bring it up is just to remind you guys that, like, hey, that's me dodging the bullet. What if I didn't get treated for that? It was abnormal cells. If it had not gotten removed, they could have easily become cancerous. And that's the truth. Yes.
I have the same thing happen to me.
Mhm.
I also went a step further and had to remove it so that so that there was
Yeah. And yeah, it's extremely common. And I also was lucky enough though to know where I had got it from. It was just, you know, I was young, but it was just this guy who I, you know, was having a relationship with, and he, before we had, you know, done the deed, if you will, had our first sexual encounter, he was honest and said that he had been with a girl that actually had HPV and had been diagnosed with it as positive. And he's like, you know, I haven't gotten tested for it or anything, but I just thought I'd let you know. And I didn't think anything of it. And that's how I got it. I know exactly where it came from. But not everybody's that lucky to even know. Most people don't know. And men have no symptoms whatsoever. So they just will be carrying it and not know that they could be spreading it to partners. So just be aware of it, ladies. Go get your pap smears. Keep up with your pap smears, please. It's getting the pap smear is way less uncomfortable than having to go through getting treated for cancer and all of that sort of stuff. So just keep up with that. So this is a DNA virus, and it does become a part of your DNA, and that's how it causes the cancer. It disrupts your cell cycle by interrupting your DNA. To put this into perspective, because the next thing, of course, that we're going to bring up is Gardasil, and there's an issue there, morally, I guess, with some folks, and you're welcome to have your opinions, but 25 to 46, that's a strange stance of numbers, but 25 to 46% of women under 25 are infected, not have been or will be or anything like that. 25 to 46, somewhere in there, a quarter to a half of all women under 25 are actively infected with HPV. Go get your pap smears, y'all. Okay. That's just because you. Uh-huh. Yeah. Yeah. So they're not, yes. So here's what we'll say, right? So we'll get into this. Gardasil is the vaccine that we have available. A lot of parents, not everybody, but a lot of parents think of this as a vaccine against a sexually transmitted disease when it should probably be thought of as a vaccine against cancer. That's what this should be thought of, in my personal opinion. It's the only, well, as far as I know, probably one of the only vaccines that we have that can actually prevent cancer. But so, yeah, that's how it's looked at. There have been issues with the vaccine. There's been several lawsuits and stuff like that. Not necessarily always with, like it's harming people. It's not one of those sorts of things. It had something to do with, I don't remember. Does anybody know what it was about? It had something to do with, I want to say they weren't being true about like how much of an ingredient there was, and people. Basically, what my point is with this is it tends to be that this vaccine is being attacked for being a vaccine for children that is protecting against a sexually transmitted disease, and because of that, people attack it for that reason. They say that is, you know, children shouldn't be given sexually transmitted disease vaccinations. That's how you get this cancer, is through sex, right? But if, and I'm not saying that your child isn't a perfect angel, because I'm sure your child is a perfect angel. But if your child weren't a perfect angel and were 13 or 14 and went out and had sexual contact, contracted HPV, got cervical cancer, and died because they didn't tell you they were, you know, active sexually and stuff like that, and you could have prevented it if you were somebody that just told them no because, you know, I'm not going to make you a harlot by giving you this vaccine, giving an excuse or whatever. You guys get my point here. So that's the argument that I have. Y'all have y'all own opinions on this, but I'm the teacher, so I'm gonna tell you mine. So please keep that in mind, though. If you are somebody who is, you know, having those sorts of opinions about this, have your opinions, deal with your family as you want to deal with your family, but please don't forget we're talking about cancer, okay? Not just genital warts. We're talking about cancer. And and I do want to be clear too. These HPV strains don't just cause cervical cancer. They can cause cancer in various parts of the body. They may be related to sexual activity. Well, we're talking about oral cavity, we're talking about the anus, we're talking about the penis and other structures, but like cancer in these areas. If you guys have ever seen pictures of the spread of you know, severe cervical cancer, it's quite disturbing. So, but yeah, usually it can get to the point where it can't be treated. It can definitely kill people. Molluscum contagiosum, this is a pox virus. It looks sort of like a wart. It can be associated with sexual transmission in adults. This is usually found in the Pacific. But here's some images of, on the left, we have a picture of a male, obviously with warts in the anal area. And then we have on the right, molluscum contagiosum, or these pox wart-like structures that you can see associated with. It's usually associated with the Pacific Islands, but we have some cases of it in the US. Thanks. Sex ed should be teaching this more than anything. Yeah. Anyway, so we have strep B, streptococcus colonization by group B strep. 10 to 40% of women can have strep, just any kind of strep. It doesn't have to be just one specific kind of species, not just strep throat strep, but other kinds of strep, like strep pneumonia and all these others. But if they are beta hemolytic, meaning, you know, we get the clearing associated on blood agar, then that can be what we're talking about with the group B strep. Anyways, point is, you can have it as normal flora, but when you have a baby coming out through that birth canal, gets exposed to it, they can get bloodstream infections, even up to pretty severe sepsis, meningitis, and pneumonia, all associated with that. So yeah, what does that remind you of? Streptococcus pneumoniae, right? So this is one of those that falls into this category. They will check women out during pregnancy, see if they're carrying this bacteria, and if they are in fact carrying it, then they will treat them with a penicillin or a derivative of it at 35 to 37 weeks to try to clear. Cool. I don't know how I did that early, but whatever. So this is our question of the chapter. Why is HSV infection so dangerous to the infant during birth? Of course, we're talking here about the meningitis and everything, but why is it so severe for them? Why are they more likely to have these severe reactions? It's just because they don't have an immune system to keep it in check. So that's the problem. So yeah, this will be our picture. We're not going to do the Kahoot today for this one. I mean, especially because we're just about to do a Kahoot anyways for the lab. I figure we'll stay here and do it. That's okay with you guys, not go to the lab. It's freezing in the lab. Plus also I may or may not have already set up the exam, so I don't want to deal with that. All right, I'm going to stop this recording and then restart. I don't know what I just did. Where is this? This one's different then.